Welcome. Welcome to Science, Health and Healing Encyclopedia of Children's Health Core and Ali Academy. I'm Dr. Majid Ali. Title of this video, No Thyroid Medications Without Adrenal-Pancreas Support, Part 2. In Part 1, I gave you my clinical observations why I never prescribe thyroid medications, whether for thyroid underactivity, hypothyroidism, or thyroid overactivity, hyperthyroidism, without supporting the adrenal and the pancreas. Why? Because in my clinical experience, nearly always individuals who need thyroid medications also need support. Now, what do I mean by support for the adrenal and the pancreas? The adrenal gland makes more than 51 hormones. Cortisol is the best known. The adrenaline is actually better known, but usually people do not relate adrenaline to adrenal glands, which is kind of odd, thinking their names. Pancreas, their digestive enzymes do not work. They produce too much insulin because of toxicity at the cell membranes, which immobilizes the insulin receptor protein. That's the nature of prediabetes, diabetes, insulin toxicity, and all complications of diabetes. Now, what do we mean by support? The long-term purpose of the support is to create the conditions that the adrenal gland and the pancreas can regenerate and resume their normal functions in preserving health and reversing disease. But in the beginning, you really do need support. So generally what I would like to do is explain to the patient that the best way to support the adrenal gland is slow breathing, Dr. Ali's breakfast, castor oil drops, foot soaks. There are separate channels on this encyclopedia on each of these items, remedies that I mentioned. Please watch them. But then in the short run, people do need some support. So I would give DHEA, 25 milligrams alternate days to my female patients, and I am more liberal and I will give 25 to 50 milligrams of DHEA, a precursor of adrenal hormones, to men, especially those who have low testosterone. But I will tell you that when I see people who have been ill for years with chronic fatigue syndrome, fibromyalgia, persistent fatigue after chemotherapy, severe immune problems, long-standing Hashimoto's disease, Graves' disease, hypothyroidism, lymphocytic thyroiditis, woody thyroiditis, Decaven's disease of the thyroid, then I usually give them hydrocortisone for a limited period of time, perhaps 2 to 4 months. And I would start with a very small dose, 2 milligrams of hydrocortisone 3 times a day. But sometimes I have to raise it to 5 milligrams every 6 hours, waking hours, until their bowel, blood, liver issues can be resolved, until their female hormones and male hormones can be looked at and taken care of, until their adrenal and can regenerate or pancreas can regenerate. The argument that I hear that hydrocortisone support is very toxic and the adrenal gland stops working, that's just nonsense. It really is coming from ignorant people who should know better because they claim to be professionals. So I can tell you, having given hydrocortisone for a short period of time to more than 5,000 patients, that if it is used the way I'm describing and your focus is on the adrenal recovery by focusing on slow breathing to get more oxygen, oil drops, castor oil, sesame mustard to cut down inflammation, peroxide soaks to get more oxygen, Dr. Ali's insulin reduction program to cut down insulin toxicity, especially if you have 15 or more pounds in excess of your optimal weight, and of course Dr. Ali's breakfast. Please look at part 3 of this series, No Thyroid Medications, for focus on the pancreas support. Our vision at this encyclopedia is to provide authentic information free of cost, free of corporate deceptions, free of ideological distortions, and free of commercial conflicts. Thank you for joining me. Please send us letters and tell us how we can enhance the value of this encyclopedia for people worldwide. Thank you.